The West Garfield Park Youth Council. And we believe that we are the solution to the issues in our community. Our theme is Nothing With Us, Without Us. Fathers Who Care is a nonprofit organization located on the west side of Chicago, within the West Garfield Park community. Again, everyone, I'm Vernisha Jones. I'm the president of the West Garfield Park Youth Council, and you are watching a live interactive program brought to you by CAN TV 21. The West Garfield Park Youth Council is comprised of young people from our community whose focus and concern is youth leadership and a voice within the community to reduce senseless violence and illegal substance use. We invite people from all over, especially our young people, to come in and see what we're all about. Our show will be scheduled every Thursday at 7 p.m. Again, that is every Thursday at 7 p.m. But unfortunately, today will be our last show, and Fathers Who Care will be airing next week at the same time, 7 p.m. Our show can also be viewed online at www.cantv.org/live. Again, that is www.cantv.org/live. Well, everyone, I would like to introduce my guest this evening, Mr. Devarsh, a Chicagoland native. Thank you so much for being a guest on my show tonight.
Of course. Thank you for having me.
No problem. Again, I'm Vernisha. I'm the president of the West Garfield Park Youth Council, as many may know, and you're watching a live interactive program brought to you by CAN TV 21. During the next 25 minutes, we are going to discuss young people making a difference and becoming future change agents. Are you ready to get into this conversation, Mr. Devarsh?
Of course.
Okay. So the first question I have for you, can you tell our audience who is Devarsh and what is your purpose for existing?
Of course. First off, I'd just like to say good evening, Vernisha, and thank you for taking the time to interview me.
No problem.
My name is Devarsh Shah. I'm a recent graduate of the Illinois Math and Science Academy, IMSA for short. It's a top STEM school in the nation. Mm-hmm. And I'm a rising freshman at UIC. And I've always been passionate about healthcare and public service. And I've come to realize that you don't need a degree to lead change. Through CADCA, Anti-Drug Coalition, I was selected as one of 10 students nationally to lead a public health initiative. And I was selected as a national youth public health leader. And I proudly represent Illinois. And I'm really here to bring that home.
Okay, I love to hear it. And so that's I heard your purpose for existing. Also, I want you to let everybody know how old you are and the little special thing that I know about you that I feel like everybody else should know too.
Yeah, I'm 17 years old.
And you graduated a year early? Tell them that part too.
When I was attending IMSA, I went from 8th grade to 10th grade, so I skipped out on 9th grade. Yeah.
How did that feel? Like, did you feel like you missed out on anything, or was it just, like, harder work? Like,
I really think that, I'm very blessed by God and my parents, for sure, for giving me that opportunity. And I don't really feel like I missed out on much. Okay. I think that, it's just hard work coming to fruition. That's what I believe. Yeah.
So I'm really proud of you. I feel like that's a good thing to be able to, because I feel like a lot of parents don't be wanting their kids to skip, but I feel like that's a good thing that you was able to have that opportunity to be able to skip a grade. Sure. And I love the work that you're doing for our community as well.
Thank you.
Can you tell us about the work that you do with CACA and what brought you to want to focus strongly on West Garfield Park?
Sure. So I'd say that CADCA, they really gave me a national platform to create sort of a grassroots level solution in West Garfield Park. So initially, when I was selected by CADCA, I was choosing which community I'd like to focus on. And as CADCA is focused on the Anti-Drug Coalition, I was looking for communities in Chicago where there was a high level of opioid overdoses. And based off my own research, West Garfield Park came up a numerous amount of times, just due to the rate and level of overdose death rates present within that community. But it also came up for another reason. I've had the chance and opportunity to spend some time within West Garfield Park, and I've came across some of the most resilient and brave people, especially through what they're going through, and maybe losing their loved ones or going through a hard time. Something I've realized is the people in West Garfield Park, they're extremely resilient, and they really want to be supported by the community.
Okay, and when it comes to like overdoses and stuff, what do you see the common age for that? Like, is it something that caught your attention because it was you seeing people around your age doing it, or like what is the common age for the most overdoses and stuff that's happening?
This past weekend, there was a huge spike in overdoses present in Chicago, and West Garfield Park was affected by this. And I think that just based off that, I don't think there was, a real like specific age group that was affected by overdoses.
Okay.
Something that we've seen, and today especially, is that people in nursing homes, they might accidentally overdose on opioids if they're prescribed them, and there's a efficacy problem as well. But what we've seen is that the people in the West Garfield Park community, they truly need to be supported, and they don't really need their entire community to be changed. They just need to be builded with.
Okay. And my next question actually plays in part with what you just said. I wanted to ask you about what do you feel like the challenges are when it comes to firsthand and addressing the opioid crisis. I know you just said off of the strength of them just needing someone. Do you think it's any other reasons why, that becomes a very big challenge when it comes to them?
Yeah, I think one of the biggest challenge is access. Not just to naloxone or Narcan, but I think that to real information and support systems. I think especially having them be, stigma-free, and allowing people to get help without being judged. That's a huge factor.
I think that's the biggest factor.
Yeah.
I think a lot of people don't want to go to get help because of the simple fact you feel of what somebody's going to say or how someone's going to judge you. So I feel like that's one of the biggest factors.
Yeah. And I think that there may also be some distrust present within the community just due to past neglect. But I don't think that in order to help the West Garfield Park community, we have to start with solutions. I think the best way we can do it is by starting with relationships and truly engaging with the community on a personal level.
Okay.
Yeah.
And is it certain locations like that you guys are, because I know you guys give away free Narcan and stuff, correct?
Yeah.
Is it like certain places where people that's in need of this type of stuff, are you guys located in different parts of Chicago? Like, how does that work?
So this week I had the opportunity to shadow some members from the West Side Opioid Task Force, and Pastor Fani especially. She's the director of the West Side Opioid Task Force, and she's sort of taken me under her wing. And we really see eye to eye to how we want to help the West Garfield Park community. And what we've been able to do is that we've been able to set up tables in various hotspots where people are known to take drugs or sell drugs. And we've been able to help people and distribute Narcan that way. And then I think that today especially, we handed out clothing as well for people. So then that way, we can sort of bring them in and have a conversation with them and truly help them.
Oh, that's what's up.
Yeah.
Why are you so committed?
I'm a really proud Chicagoan, and I think that I'm the type of person where if I see an issue or if I see people suffering, I'd like to use my skill set and what I have within me to come up with unique solutions to it. Also because being 17 years old and leading naloxone training distribution events and handing out naloxone and having it be youth led definitely gives the community a different perspective as to how we can help them, and it definitely provides them with a different point of view as to why they should get help.
Okay, and also I wanted to ask you, do you guys have what was the question I wanted to ask you? There's another it's gonna have to come back to me. I was just thinking about something in the midst of you talking that I wanted to ask. It's gonna come back. It's gonna come back because it was something important I feel like I wanted to ask. Okay, the next question I have: how do you plan to better the West Side, and what are some things you've done to push that narrative? What I really want to know the question I was thinking about.
So I'll answer this one.
Okay.
I think that it definitely starts with listening to the community and then building with them. So that's something I've started doing with the event that I'm planning this Saturday. It's called Let's Rise. So it's a youth-led naloxone training and distribution event. It's from 11 a.m. to 1 p.m. on the park at Lake and Homan, Garfield Park, NE. And what we really want to do is we want to survey people in the community and figure out how we could best help them. And what we found out was due to this lack of information or misinformation present within the community, having naloxone kits present and then also a training session, a live demo as to how you can use them, and then pairing that with different community resources such as counseling and rehabilitation services, that definitely helps provide a full circle point of view as to how they can get help.
That was my question.
Okay.
That's crazy that you answered it. That was my question. I wanted to ask you, for people that are in need of having people around them that may overdose or may be going through like heavy drugs, and you have somebody and you want to be able to help them, is there any way that they could find a way to get help? And so, okay, that was perfect. They have an event coming up, and I'm going to make sure you say that you repeat that event closer to the end when I tell you to just let them know so they can know. I feel like that's important for our young people and for people in general just to know about how to save your loved one if you have to. Mm-hmm. And I feel like enough people don't know that. We'll just be sitting there like looking lost when you could actually save somebody's life. So thank you for bringing that up, and I want you to, and where would it be?
So it's going to be at the park at Lake and Homan.
Lake and Homan.
Garfield Park, NE, from 11 a.m. to 1 p.m.
What day? Saturday,
okay. June 28th.
Saturday, June 28th, Lake and Homan, 11 to 1. 11 to 1.
Yeah.
Okay, and it's an outside event, correct?
Yes.
Okay.
Yeah. But we'll have tents and cold water and everything, so yeah.
Okay, so please come out to support him on Saturday, 11 to 1 on Lake and Homan. Okay, the next question I have, what advice would you give to other young people who want to lead change and don't know where to start or can be involved in peer pressure? Because, that's something big in your time zone right now. What is something that you would say to young people that want to do it, but they don't know what to do?
Yeah, Vernisha, that's a great question. I'd say to start with one person, have one conversation. You don't really need to have a perfect plan as to how you're going to affect and impact a certain amount of people. But I think that you just have to be real, be consistent, and lead with impact. And I think that leading with your heart and leading with community in mind is a true way to impact a certain amount of people, and truly see change within the community.
Okay, and you seem real like level-headed. Can you let us know what's next for you, like academically, professionally, like with your community work? What's in the works for Mr. Devarsh?
So I'm a rising freshman at UIC.
Okay.
Where I plan to continue sort of my advocacy efforts for opioid overdoses, and providing true help to the communities such as West Garfield Park. But I career-wise, I want to be a physician. My goal is to be a physician, and I think that having being in school for a certain amount of years and having that much information, I can truly use that and harness the power of education to impact a certain amount of people. And especially in communities like West Garfield Park, with what I'm able to do now, without being a doctor and having information on, opioid overdoses and what adulterants are present and what specifically is in these opioids that's causing the community to suffer. I think as a physician, having that information would definitely be, it would definitely help a lot of people.
Mm-hmm. Definitely. What do you feel like, you being a young person, 17 years old, what do you feel like is a big issue with our young people in Chicago?
I think that a lack of opportunity and safe outlets, I think, when you don't see many options for your future, it's very hard, it's very easy to lose hope. I'd say that hopelessness definitely shows up in a certain amount of ways, right? It could be actions that you take, or, it could be something else that you're dealing with. But I think that it's very important to surround yourself with a good group of people. And I think that being motivated and seeking God, I think that's the main thing where, you can get back on track. But I wouldn't really say there's a problem with young people. I think that it's just when you feel hopeless, it's sort of hard to come out of that hole. But, I think that seeking God and doing what you do for God, and having a mission aligned for you, I think that definitely helps with that.
Okay, and speaking on that, and speaking of the fact that you're 17 years old, we always try to get our young people's opinion about everything that we got going on. You said opportunities. Mm-hmm. Me being somebody that's in the community, working in the community, I know personally that it's a lot of opportunities. It's way too many opportunities that's not being taken advantage of. Mm-hmm. What can we do to interest an average 17, 16-year-old? What do we have to, how can we catch you guys' attention? Because I feel like it is a lot of programs, but I feel like it's not, kids don't feel like it's engaging, or they don't feel like it's what can we do to better help you?
I think that for youth, I think we should let them lead. Not only give them a seat at the table, but truly give them a voice. And I think that they truly do have a different perspective as to what's going on in the community. Because at the end of the day, the youth that we have now, right, that's our future generation.
Yeah.
And that's what's going to be, the next phase of the community. So I think that investing in them with mentorship, in different programs, as you mentioned, that are present within the community. But really, I think letting them lead is what's going to attract them. Giving them that autonomy and freedom to really pursue their passions and in turn see what they can change about the community and how they can better their community. I think that's what's important.
While you was in school, were you involved in any type of social groups and stuff like that when you was in high school?
I was part of HOSA, so it's a medical club, and what we would do is we would volunteer at various nursing homes or we'd have various outreach outreach events and things like that where we would help people in the community.
So as far as that, that was something that triggered you, and it was something that you enjoyed doing, so you didn't have a problem with being a part of the program in school.
Yeah.
Okay.
Yeah, definitely.
So that's just me asking that because of the simple fact it being like something when you find things that interest young people and stuff, and that would make kids be more involved than just randomly want kids to come out to a program.
For sure. Yeah.
Okay. Yeah. So what are some social problems that teens are going through in the community?
I think that, especially after COVID, mental health struggles, that's a very, very big problem going on in the community. And then grief and addiction, I think, as well. And then I think more so, feeling invisible, that's something going on in the community. Where, I feel like we need to acknowledge teens, and we need to understand, like, as mentioned, they're the future, right?
Yeah.
And making them feel seen and making them feel heard, I think that's extremely important to, making them feel one of the community, really feel part of the community. Because I think that once you feel part of the community, you want to lead change.
You want to do something.
Exactly. Yeah. When you see a problem, you want to help solve it, right? With any way you can. And I've met people where once they feel heard and once they feel seen and important,
they're gonna put more work into it.
Exactly. And even if they don't know, and even if they don't have the skill set to fix a certain problem, they'll reach out to 10 different people to really branch out their network and see how can we fix this problem in my community? What can you do for us, and what we can do for you? And truly, helping with heart. I think that's what's important.
Yes. And so I just heard, we normally, when we talk about stuff that's going on with our young people, we always hear drugs, we always hear violence, we always hear everything that you said. The only thing I have never heard was grief.
Yeah.
Can you explain that a little bit more? Like, I know what it is, but in your personal words, can you explain that? Because that was actually a good one, and that's actually a big thing when it comes to problems that our young people may have. You never know if they done dealt with that type of stuff in their life that they're not talking about, and I feel like that's a big one. So can you go into a little more detail with that one?
For sure. So I think that grief, it's especially, in the society that we live in today, there's a lot of stigma around, talking about your feelings and, uncovering how you truly feel. And I think the only way to, get past grief is to talk about how you feel and come to peace with what happened, right? So for youth, it could be the grief of losing a loved one, losing a family member, a friend, a brother, a sister, and sort of going through that grief and feeling that pain. It can be, insurmountable at times where you're just not able to get past it. And I think that making it and having a community where it's okay to talk about what happened and talk about what you're going through and what you're feeling, I think that's very important as for getting past that sort of grief. So that's definitely something that young people go through.
And also, speaking of that, I feel like you said, young people being able to talk to someone about that. I feel like us being able to allow our young people to feel comfortable enough, vulnerable enough to be able to come to somebody to talk about it. Because like he just clearly said, a 17-year-old clearly saying that grief is something big that our young people is dealing with in the community. I feel like just allowing our young people to have that, that safe space to where they feel like they can talk to you without it being a judgment zone, or can talk to you without them feeling like you're judging them, or feeling like them feeling like you actually care. They want to feel like you actually care. And I feel like young people know when, people don't really care about them and they just there just to listen to you. Mm-hmm. So I definitely agree with that. And I'm going to use that next time I say it, because we always, like I said, we always say drugs, we always say violence, but I have never heard grief, like that being something that can actually change a young person's mindset.
And I feel like today when we were talking with some community members of West Garfield Park, I think truly engaging with someone, it doesn't mean, just handing them naloxone or going straight to the point of, oh, what are you going through? Do you need naloxone, right?
What's your name?
Exactly, yeah.
Like, it's the simple thing.
Exactly, yeah. And I think that we became very transactional in our interactions, where we want something from them, or either we want to give them something and we don't want to truly engage with them. Mm-hmm. But I think what I've seen many community leaders doing, such as Pastor Fania, is that she truly likes to see the person at heart, and truly communicate with them, learn about them, learn a little bit about their story, and see how she has the resources, and she has how she can use her skill set to help them. And that's something I'm definitely taking after and seeing a lot more community engagement, which I'm looking forward to on Saturday.
Okay. Do you know of any resources, activities that are available to address social change for our young people? This is a time where you could actually speak on the project that you guys have coming up this upcoming week. And also, is the CACA program, is that something that people can get involved in, or how does that work?
Yeah. So people can get involved in CADCA. So CADCA is just a anti-drug coalition. It's a big anti-drug coalition. And people can definitely get in contact with CADCA. There's usually a CADCA cohort either near where you're located, so near Chicago, for example. Okay. And they do outreach programs and prevention networks and things of that nature, where you can get in contact with them and you can help other community members with what anti-drug issues they have going on. Okay. And then as for other organizations, I definitely say the West Side Opioid Task Force. That's a big help, as well as like HOSA, CADCA. There's Build Chicago, which is huge, and CRCC. And I think that with all these organizations, what's really unique about them is that they all have, they all have different things that they could provide you, right? But once you engage with all of them or a couple of them, you start getting a toolkit of how of resources, right? Where after you engage with the resources and you get the help you need, you can help others as well, mm-hmm. which I think is really cool with it. And that leads me to my event. So that's kind of what we're hoping this Saturday is going to look like. So this Saturday I'm hosting an event called Let's Rise. It's a youth-led naloxone training and distribution event.
Oh, you ain't say that at first. It's youth-led?
Yeah, youth-led. Okay. Yeah. So it's a youth-led naloxone training and distribution event. It's from 11 a.m. to 1 p.m. And it's at the park at Lake and Homan, so Garfield Park, NE. Okay. And attendees will, have the opportunity to obviously get free naloxone, but also learn how to use it, which I think is huge. There's gonna be a live demo going on, and then they can also, engage with different counseling and rehabilitation services that the community provides.
Okay, that's good. I might have to stop by that. I didn't know it was youth-led. That's good to hear our young people definitely doing something like that on the west side of Chicago. And if someone is watching and in need of immediate intervention, how could they reach out to you or reach out to the program that you got going on? Like, can they just go on CACA.com, or how could they go about that if they want to find out more information?
So if someone needs to find out more information, they can reach out to me on social media. So they can reach out to me on Instagram. It's Devarsh, DEVARSH .SHAH_.
Okay.
Yeah.
Well, thank you so much for being a guest on my show this evening. I really enjoyed talking to you. And if you're just now tuning in, our guest on tonight's show is Mr. Devarsh, a Chicagoland native, and we're discussing young people making a difference and becoming future change agents. We would like to thank our viewers for watching, and also thank our viewers just for watching this entire season and just coming on this road with me, because I've been doing this show for so long, and I appreciate everyone with your comments and your concerns about everything that we have going on. And if you want any additional additional information for our program, which is the West Garfield Park Youth Council, we have a drop-in program, which we have from Monday through Friday from 10 a.m. to 5 p.m., where we have an open space for our young people to come in with any type of necessary. If we have anything that we can help you with, we're available for help. You can contact us at 773-287-5821. Again, that is 773-287-5821. Also, I always ask my guests at the end, is this something, a quote or anything that you live by that you think it will help someone else?
I'd like to share, yeah.
Yeah.
So I was just about to ask. So I definitely say that we all rise by lifting each other up. That's something that, we've really tried to embody for this event. Mm-hmm. I'll say it one more time. So we all rise by lifting each other up. And that's how I'd like to conclude.
Okay, and Matt is the sky's the limit, but I like yours too.
Thank you.
Well, thank you so much for being a guest on tonight's show, and we'll definitely hear some. We're gonna hear some more from him probably on my next season. I have you come on. Okay.
Amazing. Thank you.
No problem. See you guys later.